Welcome back, students. Today we are going to start our next chapter, that is the disease of sensory organs. So first of them is otitis media. Okay, so let's get started. So otitis media, it's a painful infection of the ear, which actually infects the middle ear. Okay, the behavior of the children gets changed once the ear is having infection or inflammation. Okay, the small children's, because they are the one who are getting infected mostly by this condition. So once this condition infect them, they will start crying, and this will be very intense crying. Okay, and they will be again and again clutching their ear, putting their ears or something like that, and they will always complaining about pain in the ear. This is for both, not only for children's but for the older persons also. Okay, so there are three different types of otitis media. One is acute otitis media, which is the infection of the middle ear. Okay, then comes the otitis media with effusion. Effusion is, there will be the accumulation of fluid, or there will be mucus formation in the middle ear. Okay, then comes the chronic otitis media with effusion. Okay, in this condition, fluid will remains in the middle ear, okay, for a long period. Once it's treated, it will come back again and again and again, and keep the problem there and keep the infection always there. This may result in hair loss. Okay, so the symptoms, I have differentiated the symptoms in two categories, that is children's and adults. In case of children's, there will be ear pain, or the children's will pulling their ears because of the pain. They have trouble in sleeping. Okay, they will cry more usually. Okay, there will be fussiness, there will be a problem in hearing, they are not responding to the sounds. They will have problem in balancing themselves because of the hearing problem. Then their body temperature will remains about 100 degree Fahrenheit, or there will be a drainage of liquid from the ear, having headache, and they are not eating their food regularly. Whereas in adults, the problem will be the pain in the ear, there will be drainage of liquid from the ear, and there will be problem in hearing also. So the causes, if we talk about the causes, the main part which is getting infected is the eustachian tube. Okay, the one which is starting from the middle of the ear back to the throat. Okay, so once it is being swollen, there will be the problem related to otitis media. So what are the reason for its infection or inflammation? It includes various types of allergies, a common cold, or when a person is suffering from flu, or the one who is having sinus problem, sinusitis problem, or they have enlarged adenoids, or in older persons, if they are they are smoking cigarettes on regular intervals, or in small infants when they are drinking their milk or water, they are drinking it while lying down. So these are the causes. So what would be the risk factors? If we talk about small childs, then the risk factor is from the 6 to 36 months. Okay, those children who are attending daycare, okay, or those who are being fed milk through bottle, not breastfed. Okay, or again I'm saying, if the children is drinking their milk while lying down, or if we talk about the older persons, when they are smoking cigarettes, or if they are exposed to high levels of pollution, that is air pollution, or changes due to altitude or climate, or being in cold climate for a long period, or having suffering from cold, flu, or sinus. Okay, and in some cases even genetics also play a role for the otitis media. So the complication which going to come with the otitis media is impaired hearing. Person is not going to have a proper hearing. Then there will be, if we talk about small children, if they are having hair loss, they will not be able to develop their speech, or through this the infection can spread also. And while the children are pulling their ears or putting something in the ear, that can tear their eardrum also. So how to prevent these conditions? To prevent the otitis media, the one need to prevent common cold or other illness, or they should avoid secondhand smoke. Babies should be breastfed when the time is there. Okay, if you are feeding your child with the bottle, then don't feed them while lying. And last, talk to your doctor for the vaccination. So, how to diagnose? Doctors usually diagnose it by three different conditions. One is otoscope, tympanometry, and reflectometry. Okay, and the treatment is, one can be treated by using antibiotics or some other medications for the pain. Okay, so thank you. We will meet again with the next topic, that is cataract.